Good afternoon, everyone. Thank you for sharing this time with us. We're going to be spending the next half an hour or so addressing youth anxiety to really mitigate risk and improve well-being. And I know you all know why you're here today, so I appreciate your time and the fact that you're interested in kind of learning more about some of the work that we've been doing and information we're gathering to provide all of that into a toolkit that hopefully you'll find useful in your practice and in supporting parents. I'm Dr. Jennifer Salerno. I'm a licensed pediatric nurse practitioner and translational researcher in the field of youth risk and prevention. I've done a lot of work with youth risk over the last 30 years in identifying that risk, providing resources directly to youth, and then supporting professionals and parents in helping to really bring that community together and reduce risk as a team effort. How we're looking to engage today in the webinar, please view the presentation in full screen mode if you can do that. That way you'll be able to see all of the things that we're sharing. Some images may be a little bit small. Utilize the chat. Open that up right now if you can find it on the toolbar. We'll be including in the chat some links that you may be interested in clicking and following on. I'm working with Mackenzie, who's a part of the Possibilities for Change team today. So she will be on the back end and including different links as we're talking through different content areas and slides. If you have any questions, please use the Q&A box. So look under your taskbar, under the more, you might find it if you don't see it. Kind of pull that up, and as I'm talking through things, if you have questions, just type them into the Q&A, and I'll answer those at the end. Also, Mackenzie is going to be monitoring the Q&A, so if you have any technical issues or any other questions, she'll be able to answer those right away for you. So when I'm thinking about anxiety in youth, and I'm sure all of you are feeling the same, we have a lot of feelings around that. Some of those feelings are our own anxiety, just in knowing what to do, what to say. We're in the business of helping youth. And part of that is wanting to fix and wanting to fix them. And if you're a parent, you even have those feelings this much higher. So thinking about identifying anxiety, we know that we need to do that. And yet at the same time, it causes us anxiety in just wanting to help and wanting to say the right things and provide the right resources and just kind of come alongside them in a way that will help reduce that anxiety. So if you look at this image, for me, it immediately brought to life the idea of what it might look like if we could peek inside the mind of our youth that are experiencing anxiety. You see all these clouds, thunder, you probably see lightning. We're also really looking for that relief, like that brightness in the middle of the clouds of how can I reduce these feelings? How can I step outside of that? So it's this whole turmoil going on. And this image is actually one that my son sent me. So he's a commercial pilot and he took this picture from the cockpit of his plane during a flight this past spring. So when he sent it, I'm like, wow, this is a really cool image, really cool picture. And then when I was looking for something, I was like, oh, this is the perfect thing, because not only is it about kind of how you're feeling or how our youth are feeling when they're anxious, you can also look at it as having different lens of the same situation. So, being up inside of the cloud and inside of that turmoil, if you think about anxiety and what that looks like. And at the bottom of that image is what you're seeing if you look down at the lights of the city that he was flying over. So if people from that city were looking up, they might just be seeing clouds. Maybe they're gray clouds, but they're not seeing all of that turmoil until the sky opens up and, that rains down. And a lot of time, that's what we see and experience when we're working with youth, that they kind of keep it to themselves. And maybe there were a few things that happened that you could say, oh, I could see where they were having some issues, but I didn't put it together. And then all of a sudden it kind of explodes. So I thought this was a really nice way to kind of lead into our conversations today. These are the headlines that you've all seen in different public health sites, different just news stories over the past few years. And for good reason, because youth anxiety is really on the rise. It's everywhere. A large portion of my work is related to youth risk screening, and we've been facilitating screening across the US since 2009. So up until COVID, the rates were pretty consistent when we looked at data across hundreds of thousands of youth. Anxiety was about 10 to 20%. Now, since COVID in 2020, we just looked at the rates so far for 2024. So we're in, the month of October. What we saw were rates from 30 to 50%. And I was actually shocked when I looked at the numbers and kind of re-looked at them a few times to make sure that we were seeing the correct information, because when we looked at screenings from 8 years old all the way to young adults, the highest rates in the 50s were the youngest youth, so 8, 9, and 10 years old. So then you can step back and say, hey, what's causing all of this? Obviously, isolation during COVID, and then kind of coming out from that, financial struggles that families may be having with food insecurity, housing, all of those different things. But the research also shows us that social media use, anything that's 3 hours or more in a day, and that can easily get eaten up, with kids coming home from school, just sitting on social media, even with the TV on, they're still scrolling their phones or, during other activities. 3 hours seems like a lot, but then, you think, that's probably pretty realistic. So any youth 3 hours or more have a significantly higher rates of anxiety and depression than youth with less use. Also, some recent research showed that parents that are on their screens a lot have youth that have higher levels of anxiety. So if you're talking about anxiety with parents or with youth, think about the role of just screens, technology, social media. Those might be some initial ways that you could talk with families about trying to help reduce that influencer to reduce the risk of anxiety. So what do we look for in youth that are experiencing anxiety? And recognizing the signs and symptoms is really crucial to everybody that works with youth, whether it's educators, health professionals, other professionals working with youth, providers, parents. Early identification can really lead to timely interventions and support. So the earlier we recognize, the less likely that we'll see that storm kind of explode out from that youth's life. What we've done is pulled in some of the most common symptoms across the age groups. And I've broken them down into 5 areas. So looking at these areas, we'll kind of walk through each one. You'll know and say to yourself, or maybe if you're sitting with someone like, wow, these really are signs of normal adolescent development. So if you're familiar with starting at the age of 9 all the way through 24, there's a lot of changes happening related to puberty and development. And some of these are normal for those different milestones. What you want to note is if these signs and symptoms are happening consistently over periods of weeks or months, then at that point, it might be time to kind of look into that a little bit deeper, or to let parents know to kind of follow through with seeking some professional help. So the first area is behavioral indicators. So avoidance of school, skipping school, maybe social events or times with their friends that they had previously enjoyed, changes in sleeping patterns, difficulty falling asleep, staying asleep. We know technology really affects sleep patterns as well. And then changes in eating habits like loss of appetite or overeating. And some of that is also developmental as kids are really in those growth spurts, you'll notice that they're eating a lot more. So it is kind of difficult to recognize early some of those signs of anxiety if there's just a few popping up here or there. Emotional indicators, persistent fear about everyday situations. So going to school or having social interactions, being irritable. Youth that are younger and all of a sudden they become really irritable may be a sign of anxiety. Being restless and having difficulty relaxing. Physical indicators, these are things that you'll see as a nurse practitioner, see a lot of just frequent headaches, stomach aches, other maybe pain in certain areas. We've done workups, we've looked at everything, and we don't see any physical or biological reason for that. May start thinking about a mental health factor that might be kind of coming out through some of those complaints. Fatigue, having low energy levels that don't seem to correlate with other things that are going on in their life. And then panic attacks are a little bit easier to note because they're intense episodes with heart palpitations, sweating, feeling like they're going to pass out. Those are some of the symptoms they might share. Cognitive indicators, difficulty concentrating. So if you have a parent that is worried, maybe they think they have ADHD, make sure that you're also screening for anxiety because that can cause youth to not be able to focus on tasks, to follow through, to get lost when they're in school in what they're doing because their mind has kind of taken over what their thoughts versus paying attention. Negative thought patterns, just having pessimistic views, being a perfectionist can sometimes lead to anxiety when they're not perfect at doing something, whether that's school or their interests, other interests or sports. And then social indicators like withdrawing from friends and family when they were engaged in the past, then just an overwhelming fear of judgment just can be a difficult one as well with social media in particular because of all of the pressures of posting the perfect pictures or the perfect like comments that go along with someone's pictures and others commenting on, some of their social media channels. So that can be a little bit more difficult. We've created 2 infographics that break down how anxiety manifests differently at various stages of youth development, from childhood all the way to adulthood. And understanding these signals is the first step towards effective intervention. We know that anxiety can affect daily functioning. It impacts their ability to participate in school, make friends, engage in activities. Early intervention is crucial to helping them develop those coping strategies and resilience. What we've seen looking at the research is anxiety symptoms in kids can appear at any time, any age. Doesn't mean that they started to have some of those symptoms young. Maybe they started at 20. But often anxiety symptoms manifest between the ages of 5 and 7. So if you're working with youth or parents, that can be a time that you might want to think about some of those signs and symptoms. So this infographic, if you click on each of those images of youth, it will pop up those anxiety symptoms that are most common at that age. Then the bottom, we've created an infographic to go along with this one, ideas for decreasing that anxiety. So you can click on each of those icons to really help with some strategies that can be applied both in practice and in home settings to help youth kind of come out of that storm and start feeling a reduction in those symptoms. They're really practical tools. They're things like getting movement. It doesn't have to be exercise or playing on a sports team, just moving. Spending time with peers, that's a normal developmental milestone to begin with, that youth are kind of separating more from parents and interested in establishing peer relationships. So if they're not progressing in that, that can cause some anxiety and depression as well. having that family time. So knowing that family support, caregiver support is the number one protective factor for youth mental health is so important to share as you're working with families. Even if we know families are busy, parents are working two jobs, sometimes it's just not possible to spend a lot of time, especially during the week with school, work, that sort of thing. Just having that screen-free time, whether it's a short amount of time during the day, during the week, a few days a week, maybe it's on the weekends, having at least one dinner that you spend together as a family has shown significant results in strengthening those family relationships and then therefore reducing risk. Having hobbies and activities, moderated time on devices we talked about. Outdoor time is really important when the sun is out. The sunlight does have a positive biophysical effect on mood, calmness, focus. It is in and of itself an intervention and then therapy as well. So we'll go into a few of those in a little bit more depth. So thinking about signs and symptoms, as professionals, we're really relying on parents to share some of those things that they've been seeing in their youth. We're asking about a history and other things that we just talked through. We typically use some type of screening tool to help us quickly understand if anxiety is a risk for that youth that we're serving. Some of the common tools you may be familiar with are the GAD-7, the Beck Anxiety Inventory, even the PHQ-9, which is a depression screening tool, has some items that also relate to anxiety and can provide some insights if your setting is using something like the PHQ, but not any specific anxiety screen. It can still give you some idea on whether or not anxiety may be a risk. Early identification of anxiety is crucial. We've kind of talked through that a little bit already. Why screening matters, what we should be looking for. Using validated screening tools is the most effective way to identify because they've been tested in the age group that you would be using them. So something like the GAD-7 can be used at 11 or 12 and older. There's other mental health tools specifically for depression or suicide that go down to age 8. It's recommended to start screening youth at age 8. So finding a tool, depending on your population, that is the best fit is probably the first step. And then figuring out, how am I going to work that into my workflow? Am I going to use technology? We know that technology has been shown to be most effective when youth are completing any type of question. Using technology, they feel most comfortable, they feel safe in that, and then they want to have the conversation, but they don't want to disclose face-to-face some of the things that they're feeling. So some of the technology that we've developed and have been using over the years is called ADAM. And ADAM is the nation's first system with a trauma responsive framework. So if you're working with populations that have experienced a lot of trauma, you want to kind of take those trauma-informed practices and put them into place in your particular setting, your practice, your workflow. What we've done is taken trauma-informed practices and translated them as they fit into a technology framework. The technology was designed by an interdisciplinary clinical team and software engineers. So that makes it a little bit different as well because of having that clinical and education piece, as well as the expertise of what technology can do is really a nice fit for the ADAM system. So what we do is within ADAM allows for administering youth screening from any device. So it might be a smartphone, a tablet, computer, any device that's internet enabled. We've taken that screening, those validated tools, and really added in those pieces of supporting youth when they complete the screening as they're completing the questions, but also at the end with some brief interventions and supporting the professionals that would be working with youth, because as a professional, sometimes it's hard to know what to do next when you identify risk, especially if you're identifying like severe anxiety. The system also has components that track risk over time to help you see improvements in youth that you're serving, that you're working with, being able to pull data on that to show the changes that have happened in youth over time as they've been accessing your services and interacting with your providers. And also has the option to integrate with multiple data systems. So we've done programs that look at healthcare data, academic data, and risk, and really try to understand and predict what is happening with youth. Is it that anxiety is going up and then academics are going down, or health is changing? You know, what's coming first? And if we can see that starting, how do we stop that from continuing to grow and kind of help to reduce those symptoms? So that's really the foundation of the work that I'm most passionate about. So with the technology, the screening happens, then a discussion occurs between a professional and a youth. It can also be used. We do a lot of work with schools in school-wide screening. So every student receives screening, they get a brief intervention, and then only those students that are at highest risk are followed up with individually. And then you have a report on your population, and then that change over time if you're using the system with youth over time. I wanted to share just a little bit of the look and feel and what makes this system different than if you're thinking about screening with technology in SurveyMonkey or some type of other system like that. The trauma responsive framework really incorporates design elements as one of the components, such as just showing one question at a time. We're unstacking long questions or sequenced questions so that you can better understand what they're answering. There's images of teens, diverse images across the questions related to the content, and then you can see the audio bar there. So that's just a few of the ways that we are trying to engage youth as they're completing the screening. When they complete the screening, we've developed brief interventions for every tool that's in the system. So they'll see a reflection on how they responded. And this is a really important piece, whether you're asking questions verbally, whether it's on paper or technology, that youth get some type of immediate feedback. Because think about when you're answering questions, even if you're sent a survey ahead of time for an appointment, or you're sitting, filling it out before you see a provider, you're kind of waiting for them to say something about the questions that you answered. So this gives immediate feedback to help kind of reduce that anxiety of where did those responses go, and what do people think now that I shared this information. So they see that reflection, they see a menu of options, which are in bullets, ways to kind of reduce that risk. And some of those might be what we already shared, depending on the tool, like spending time with friends, having movement, like going outside. If we're talking about mental health, sometimes it's journaling, listening to music. So giving them some ideas that they might work on implementing immediately. Having an affirmation is really important, or a self-efficacy statement within the message, and then resources. So those resources are typically chat lines, hotline numbers, and youth-friendly websites that are national organizations or government run. Then just on the other side for professionals, what we've tried to do is really support those next steps. So part of looking at a completed screening is that you see the score, what that score means, all the questions and responses, of course, but also some suggested guidance for next steps. So if I have a youth that has severe depression, which is this example, one of the suggested guidance is to create a safety plan. So now we have clickable links that will open that PDF, which is a fillable PDF. I don't have to go looking for, okay, I know I need to create a safety plan. What am I going to use for that? Or how can I find the correct document? I have it all right in front of me. So part of my work is really supporting those next steps in wanting professionals to also feel comfortable in asking difficult questions and knowing kind of some resources and ideas for moving that forward. So now that you've identified anxiety risk, what's next? And we put together some tools and resources that will help you with those next steps. Earlier, I shared some that, anyone can use, parents, youth, that you can give them to, get more sunlight and things like that. These are more specific to you as a professional that would be working with youth, and what are some of the resources that we can provide to you so that you feel more equipped to have those conversations and then follow through with next steps. So we've kind of broke it down into these 6 categories, and all of this is available on our online toolkit, and I'll show you that at the end of this webinar so that you have an idea what that looks like, and then we'll share a link that you can access those resources as well as some resources to support parents. So having open communication, utilizing effective communication strategies like motivational interviewing, if you're familiar with that theory of communication, that's really important. We've created some resources for you around that. Mindfulness and relaxation. We've found some resources that we feel like are really good to share with parents, or that you could utilize if you're gonna, try something with the youth as you're seeing them in your own setting. Therapy, obviously cognitive behavioral therapy, or CBT, is one of the most effective related to anxiety, but there's a lot of other therapy modalities that might be used. Medication management. We have a chart that gives you some general information just so that you have it in the back of your mind, but really that's part of having a full assessment and understanding the needs of the youth and the family and whether medication is a fit for them. Really involving school or giving schools some supporting like interventions and strategies they might be able to use in the classroom. I know a lot of times, especially elementary school, youth either get really irritable or they get really emotional and can have outbursts in the classroom, and that then can make the anxiety kind of worse. So you want to make sure that you're incorporating strategies that parents could share with schools or that you're sharing with schools, and then having that family involvement piece. So if we think about communicating effectively, we put together this open communication strategy. So utilizing motivational interviewing, which is evidence-based effective communication for youth and adults. We have put together some talking at versus talking with. So I think this type of information really hits home the difference in just changing up your communication and how that feels. So if you were a patient that was coming into me and I asked you questions on the talking at part, these are very normal questions that probably many professionals and providers ask as they're seeing, different youth. Like, are you feeling anxious? Are you worrying? Those kind of questions. And a lot of times when we ask closed-ended questions where it would be yes or no, youth will automatically take the easy path of being like, no, no, I'm okay. Even when parents are asking questions like that, you're like, yeah, no, I'm not having any problems. Do you need any help? No, no. So if I asked you, are you feeling anxious? Think about how that feels and how you might respond. And then if instead I said, it's totally normal to feel worried about things at home or at school, how are you feeling about everything? How does that feel different? It more like open, more welcoming, more feels more like you want to know the answer to that instead of saying, are you feeling like, how are you feeling about everything? Same with, do you need help? Do you need help? Or what would help you feel less worried? Now we're trying to get youth to think about what are the things that they might need. What do they think would help them? So these are ways to just kind of change up your communication. In hopefully youth will then be more open and share more with you. That's typically what happens. Obviously, there's different personalities and things like that. But the more that you use the talking with or more open questions, the more that youth will share information with you. Even as parents, the more that you start using some of those fully open questions, which is what they're called, then the more your own teens will start sharing. Maybe not, right away, but as you're continuing to do it, they'll see like, oh, this is something that my parent is interested in, or my caregiver. It's not just like a one-time thing. We also have a course. So we have an online course that builds your skills in communicating and guiding youth towards positive change. So we have 8 credits attached. If you're interested in kind of going beyond those open-ended questions and ways to change up how you're asking a question, this really digs into and equips you with strategies to communicate more effectively to really guide youth towards reducing risk. And Mackenzie can put into chat a link to that if you're interested. Next, we're talking about mindfulness. So that's another tool that can be really helpful. And mindful means just being fully engaged in the present moment. So thinking about that in these different areas, eating, the way you're breathing, walking, thinking, if you're working with youth that are driving, some of these can be done like the breathing exercises, no matter what situation they're in. So we've found a resource that really breaks those down and gives you some tangible ways to really incorporate those techniques. Then there are also apps designed with youth in mind. Apps for mindfulness are the Headspace and the Calm. They include specific sections for kids and teens, and then apps for teens related to therapy, because sometimes it's difficult to find a therapist in the area, therapists that are comfortable with kids and with teens or effective with them. Both Talkspace and not Health, offer online therapy for teens with licensed providers. They can communicate with their therapists through text, chat, or video, which helps to kind of give them some different options and things that they might feel more comfortable with and pursue versus kind of a sitting together one-on-one. So it's nice to have some options in mind when you're thinking about those. And obviously, these are options that you would want to research on your own and make sure it fits with your practice, your population, all of that sort of thing. And then the American Academy of Child and Adolescent Psychiatry has some like options on their website that you can put in your area, and it will populate for you a list of those professionals in your area. Sometimes, especially child psychiatrists are very hard to find. We know that parents are typically reaching out to schools, to healthcare providers, to really help them find resources, and sometimes they're just not available in your area. So utilizing some ways that you might access different professionals, and maybe that's a telehealth then visit or a conversation if it's somebody that's not in your area. And then medications can be an effective component of treatment for anxiety as well, particularly when you combine with therapy and other supportive interventions. So this table was developed for parents, but I thought it had some great just general information on common medications that are used with youth, what some of those like side effects and different dosing is, just if you want a background in medication. It's not meant for prescribing. It's essential for healthcare providers to carefully evaluate each child's individual needs and decide on the appropriate intervention or medication if that's appropriate, and then monitor for side effects. But to have just kind of an idea and a background of what's typically prescribed can be really helpful. So we thought this chart was really good. And then the other piece of the online toolkit is a supporting parents links. So we put together what we call a 4-in-1 bundle. Two of those documents are the documents that I already shared that were the symptoms, the images of the youth over time, and then the different types of intervention that you may, or strategies that you may share with parents to help reduce that risk or build those family relationships. So those two infographics are in there, as well as a document that includes 4 tips for parents to talk about anxiety. So taking motivational interviewing strategies and breaking them down for parents in the scenario of talking about anxiety or situations that cause anxiety. And then we put together discussion questions that's more the size of a card that parents could use to just help them open the door to conversations. So discussing with youth, how they're feeling and about anxiety, just what would help them to feel better or reduce that risk. So questions that parents can use with their youth. Then we also found some other kind of unique resources that we put in there as well. We found a stress activity book that's for 8 to 10-year-olds, I think, that has like crosswords and word searches and a few coloring pages. So that can be nice if you're interested. If you work with younger youth, they might be interested in that. We have microlearning for parents, as well as many other parent workshops and courses. But the microlearning is meant to be 5 minutes a day for 7 days and really helps parents to understand some of those basic motivational interviewing strategies to build those relationships or build that protective factor. And then we included the medication options document. So the chart that I showed you, we pulled out of a bigger document that's meant for parents that was developed by the National Mental Health Institute. So the way to access the toolkit is what you see here, and Mackenzie will drop a link into chat. You can go to that link. We have obviously a QR code here. What I want to do is just kind of hop over to that for a minute to show you what that looks like. You can see that on my screen, but let me just get it closer. Okay. So we've titled that Empower Youth, Reduce Anxiety, Tools for Every Stage. So all of the things that I went through on the webinar, you'll see on this webpage. So the anxiety symptoms across the youth continuum, the strategies to decrease. Then we have the section of supporting parents. So you can click on the 4-in-1 bundle, the activity book, the medication guide, and then strengthening communication through that microlearning. So there's an information sheet there. And then for professionals, we have learned more about the ADAM technology that I shared, the open communication, this document that shares talking at, and then how to adjust that communication or that question to a talking with. The Mighty Change skill building opportunity, that online course, you can learn more there and access that. And then our mindfulness and relaxation techniques, the different resources that we found that we felt were really good in providing some specifics that you might share with parents. The apps for mindfulness, the therapy search that I shared, the apps for teens, and then the medication document. So all of that is there if you want to click on and access any of those resources. And let me just hop back to, okay. So just a little bit about Possibilities for Change. What we do is deliver practical evidence-based tools and workshops. So technology, support for professionals, and then support for parents. So this all kind of encompasses each of those pieces. Anxiety, really identifying, supporting the work that you all are doing, but also supporting that parent relationship. So hopefully you've seen today some pieces that you want to take out, you want to look at, maybe you want to use in practice or at home, in your schools. Feel free to, download any of the things that we have in the toolkit. If you have, look at that and you use different resources that you really love, please send us a message because we would love to, add to this as we learn about different resources that all of you think are really effective or helpful when working with youth or parents. So let me see if we have questions. So if you have any questions, please put them into the Q&A. I don't know if there's any questions in chat. I can take a look at that too. Is it possible to receive a copy of the slides? What we're going to do is this is recorded, so we'll have this available on our website that you can go back and look through or watch, share with other colleagues. Most of what I shared with you is in the toolkit, so there shouldn't be too many other things in there that you're missing. But if there's something in particular, please let me know. Any other questions? Please reach out. You can see my email here, all of our different social channels. The Instagram and the Facebook is really parent facing, and then the LinkedIn and the Twitter is professional facing. So we do blogs every month, have different types of topics. Happy to share anything that we are doing with all of you, because the more that we can share with each other, the more that we can support the youth and families that we're working with. So I really appreciate your time this afternoon, and we're right at the 2:44. So thank you so much.